a role play card that we can have a look at. So just let me know. So can you see this, Sukaina?
It is very small, but I will try to magnify.
Okay, I'll make it a bit bigger here as well.
Okay.
If I maybe, is this better?
Yes, it's clear now.
Okay, perfect. So naturally, you'll be looking at the candidate card.
Yeah.
And you have your information there. So as in the actual exam, you're going to get 3 minutes to have a look at the information.
Okay.
And then we're going to do a 5-minute role play to assess your speaking. Okay.
Okay.
Okay. So we'll start that from now, the preparation. Okay, Alex is just coming in for a moment, so I'm just going to bring him in.
Okay.
Sorry.
Hello, everyone. Can you hear me?
Yes.
Hi, Alex. How are you?
Hi, I'm good.
Good. How many students are in the class, Alex?
So I can see there are 9 participants.
Awesome. Okay. So great, everyone. So I just wanted to quickly just introduce Alex if you've not been taught by him before, but he's been doing a lot of our Facebook Live classes. And today, what he'll be doing, he'll be choosing people who give really good detailed feedback in the chat box. So make sure you give feedback on other students speaking, okay? Because I always say every week, the more that you give feedback on other people, the more you're able to analyze more effectively, the more it will improve your own performance. So by helping other people, you help yourself, okay? So Alex will be doing those role plays with you. So please give feedback in the chat box and enjoy the class. And yeah, just make sure all of your microphones are muted if you're not speaking. But I think, Alex, you've already chose Sukaina.
That's right.
Speak first. Awesome. So I'll leave you in the very, very capable hands of Alex.
Okay, thanks, Alex.
All the best. Take care, mate. Bye.
Thanks. Okay. So Sukaina, how are you doing in your preparation? Would you like another minute to prepare? Yep. Okay, so another minute to prepare.
For this short time. Yeah.
Okay, no problem. Okay, Sukaina, so we've had some time to prepare. Are you ready to begin?
Yes, sir. I can start now.
Okay, perfect. So when you'd like to begin.
Hello, my name is Dr. Sukaina. How can I help you today?
Hello, doctor. So it's about my child who's been waiting to see a doctor. We've actually been waiting now for over an hour in order to get an appointment. She's been suffering with really bad stomach pain, and she's not eating, or she doesn't want to eat, and she's feeling sick a lot of the time. And I'm very worried about her, and I'm worried that she's got a serious illness, and I wanted to see a doctor as soon as possible. I'm just wondering why it's taking so long.
Okay, first of all, thank you for your waiting. And as you know, the emergency department is so much busy. We have a lot of cases, and most of them really are severely, have severe problem. Again, thank you for your waiting.
But how long am I going to have to be waiting for? I think that my child really is ill, and I'm worried about that.
Don't worry, everything will be okay.
Can
you tell me, please, in your own word, how is the condition has been starting with your child?
It's something which is really sort of started quite recently. I mean, like, she's had the stomach pain that she's been telling me about today, and it's particularly, she tells me it's on the right side that she has this pain. So I don't know, whether it could be some form of, I don't know, sort of like appendicitis. I don't know. I really don't know. But yeah, so it started quite recently, but she's really sick. She's really ill.
Can you tell me more information about what is the type of symptoms he have?
Yeah, so as I say, it's the right side where she's been feeling the pain, and she's been feeling sickness, nausea, and it seems to me like she could have some kind of infection or something. And I say she doesn't want to eat. She's very reluctant to eat anything.
Oh, really, I'm sorry to hear that. Let me examine him, please, and we can reassure you after examination.
So you're going to examine my child?
Yeah.
Okay. Okay, that's great. So you're able to do that now?
Okay.
Okay, that's great. So I need, obviously, to know exactly what is wrong with him.
Don't worry, your child is between the best hand of care, and he will be good managed.
Okay. I'm just, in terms of sort of what ends up sort of being the situation, I'm a little bit worried about the possibility of surgery, because obviously he's only 9 years old, and do you think it could be something that might require surgery?
I realize that this condition must be so stressful for you, and you must be so worried about your child. But let me reassure you, based on his symptoms and after his examination, it seems that he has what we call appendicitis. Have you ever heard about this before?
Yes, of course. Yeah, I mean, that's quite serious, isn't it?
No, it is not serious. It is much better that you already brought your child to the hospital. And like this case, we need to run another investigation to be sure, blood test to be sure from the diagnosis.
Okay, but I mean, if it's appendicitis, then she's going to need to have it removed, right? Which is obviously, that's going to involve surgery. My child's only really young, and already he's going to have surgery.
Don't worry, this is appendicitis, so much common even between this young age. Once the diagnosis is confirmed, as I mentioned to you, by this blood test, it is easy, and it is every day. It is done for a lot of patients, especially, as I told you, your child will be in the best hand of care. It's so much simple.
It's done on children, this sort of operation, often?
Yes, just a few months back, it was done already for my child, and he's very okay now. He's like the age of your child.
Okay, but are you sure it's appendicitis?
As I told you, after based on the symptoms and after examination, I believe that is appendicitis, but we will be more sure for your assurance also after running of this blood test.
And will my child have to have surgery?
Sorry?
Will my child have to have surgery?
After we have back the test result, the surgery will be done immediately.
Okay. Okay, thank you very much.
Any other question or any other concern?
Well, no, I just obviously I just want my child to get better as soon as possible.
No, nothing to be alarmed about. It's a very simple surgery.
Okay. Okay, thank you very much, Sukaina. Thank you for that.
I need feedback first.
Say again, sorry?
I need feedback.
Feedback, of course. We'll get you some feedback, no problem at all. In terms of the other people attending the chat at the moment, if you would like to share some feedback, please do so in the chat, or if you would like to share some feedback orally, then I can bring you in as well. So just let me know in the chat if you would like to share feedback orally, or if you've got some feedback for Sukaina based upon the role play that we've just done here. So I'm just going to give a few moments, and I'll obviously also give some feedback myself. Okay, so I can't see much happening in the chat at the moment, but I'm sure people are going to give some feedback. So I'll start to begin with. So you did a good job, Sukaina, in terms of the main focus of the role play, which was to try and reassure me as the parent. I obviously was anxious about the fact that my child was experiencing these symptoms, and you used phrases in order to try and reassure me in my anxious state, which was obviously appropriate and a good thing to do. Jing Tong has made a point here saying, try to avoid everything will be okay. So you were using that as a way to try and reassure me because of the fact that I was anxious at the time. Although sometimes when you use an expression, I understand why Jing Tong has said that. Sometimes when you use an expression like everything will be okay, it's not convincing. And also, you can't guarantee that everything will be okay, certainly not before you've actually looked at the child. So it's good to use reassuring techniques and things like saying, look, we do this operation a lot. This is a common operation. It involves very few complications. There's a very low risk of complication. These things are all really good things to say. But yeah, maybe everything will be okay might be a little bit too strong because it's not something that you can necessarily guarantee. So in terms of going through the different parts of the task, you did that. You did apologize for the delay. You explained that there had been demands on the emergency department. You asked for an explanation of the condition. And you reassured me as the parent, and then explained a possible diagnosis. I think the only thing that maybe was missed from the task is that the appendectomy, the operation, it says may be necessary, whereas in the discussion it seemed that you were quite strong in terms of saying that it will be necessary. It will have to happen. So just be a little bit careful there. It's worth sort of letting the parent know that surgery is a possibility, but it's not necessarily going to happen as 100%. So just in terms of making sure you're communicating accurately, I think that would be worth bearing in mind. You used good intonation, so when you were speaking, you were trying to use sort of rising and falling intonation in order to help to communicate your message to the parent, which is an important thing to do, to show that you care and to try and provide reassurance. So that was strong. In terms of grammar, there Ophelia has put to take a look at your tenses. I don't know if maybe Ophelia you could give some specific examples of that. That would be good. But I did notice that there were some errors in word order. So you were saying, for example, that the department was so much busy. So that's not quite correct. So you could say it's so busy, it's very busy, but so much busy is grammatically not correct. And then also you said he will be good managed. So again, grammatic, you want to say he will be managed well. In this case, well rather than good. Well as the adverb. And then you said every day it is done this operation. Okay, again, word order. Every day this operation is done, or we do this operation every day. So just sometimes there are mistakes in terms of the order of the words with the grammar to have a look at. Ophelia said, is that the simple past tense as well? That there was sometimes missed, so something to have a look at. And I'm sure you can see in the chat, Sarim. Yeah, I mean, asking the name is not a bad idea, just to sort of build rapport. I think even more important than the name, although that is a good idea, would be making sure you check the sex of the child. So so you assume that the child was a he. If you ask the name, then you can sort of not have to make that assumption, and then you know, okay, if the name is sort of Emma, then okay, great, it's a she. If it's Tom, then it's a he. So so yeah, that might be a good idea as well, just sort of getting a little bit more information on a personal level. But yeah, lots of good stuff, particularly on the task basis, on the task achievement. I think the grammar is the main thing to focus on to help you sort of get the score that you want, as high a score as possible. Okay. Okay. Any other comments? Let's have a look at the chat here. Sulkaina, does that make sense?
Yes.
Yeah. Okay.
Thank you so much.
Good. Okay. No problem at all. So some more open-ended questions as well. Sarim has said, I thought you did well in terms of asking about, you know, sort of what the situation was. So that was, I thought that was pretty good. So lots of good comments being made here, particularly from Ophelia, Sarah from Diagnosis, Wrong Proposition, and Sarim as well. So I'm going to bring Sarah in next. So let me just do that now. Hello, Sarah.
Hello.
Hi there.
Yes, hello. Hi.
How are you doing? Are you okay?
Yes, fine.
Good, good. Where are you today? Which country?
I am in KSA now at work.
In where, sorry?
Beautiful. I'm in KSA, Saudi Arabia.
Ah, right. Okay, perfect. And you're currently at work. Okay. Well,
Yes.
so are you? So sorry. Are you a nurse or a doctor?
I'm a doctor.
Okay, great. So I'm going to bring up a new scenario here. Just let me know. Okay. Can you see the new scenario clearly?
Yes, 4-year-old son.
The 4-year-old son. Yeah, perfect. Okay. So I'm just going to give you then 3 minutes to prepare, to have a look at the situation here, and then we're going to do the role play. Okay. Sound good, Sarah?
Yes.
Okay, perfect. So we'll start the 3 minutes now. Okay, Sarah, are you ready to begin?
Yes.
Okay, that's great. So,
hello, I'm the attendant doctor here in this clinic.
hi, doctor.
How may I help you?
So I'm here with my son. He's only 4 years old.
Okay.
And he's had a cold and fever for the past 2 days. Yeah, he's also got a strange rash on his stomach, and it seems to be spreading.
Okay.
Yeah, and I know that he's told me it's itchy and it's sore. So yeah, I just wanted to know what was wrong, really.
So what do you notice else on your child condition?
Sorry, could you say that again?
What did you notice on your child condition else? Something else?
Well, no, just the fact that like I said, he's got the cold and the fever and the rash. That's all so far. Apart from that, he's okay.
Okay.
Yeah.
So pardon me?
Well, I was just going to say that I'm just a bit worried. He hasn't had chicken pox before, so I'm a bit worried that I don't know. It could be chicken pox.
I'm just going to check his body.
Okay.
So from the examination, I can see there is an obvious rash. And most probably it's something called chickenpox, as you said.
Right.
And from the history before, so it's very probable to have another attack. It's okay. It's okay in this. It's something very usual in this age.
Okay.
And it's very something common with your child age. So what I'm going to do now to give your child some medications such as a cream to help to reduce the itchiness feeling, because it's very annoying. And so to stop him scratching his skin all over the time. And some painkiller, because usually in chickenpox it hurts.
Yeah.
And yes.
Well, okay. So so you're going to give him what kind of medication is it going to be for the rash?
A cream to help to reduce the itchiness and the rash. It's going to take some time to reduce it, but it's like a daily cream massaging 2 to 3 times a day.
How much time do you think it would take usually? Because obviously it's quite uncomfortable.
Usually 10 to 15 days. But it's very it's okay to feel that, because it's very common and usual, as I said before. It's going to improve through time.
Okay. What about?
Yes.
Sorry, I was going to say, what about? Is it contagious? Like other people at risk, other people in the family, for example?
Yes, it's very good to not to share the personal items with each other. Try to just use a very private items for him, like his personal towel, his personal equipment, everything for him only. So just to stop spreading or spreading the infection to other family members.
Okay. I meant to mention before as well that I'm a bit worried as well about his temperature. I mean, his temperature is 38.5 degrees, and so does he need to go to hospital? Because I mean, his temperature is very high.
Actually, there is no need for hospital admission. If it's static at 38 degrees, it's okay. If it goes above 40 degrees, you need just to call the emergency and bring him to have the available emergency service at that time.
Okay. Okay. Well, thank you very much, Doctor.
You're welcome.
Thank you. Okay. Good. Thank you for that, Sarah. So just as before, guys, please do let me know your comments in the chat. As Alex said before, those that give the best feedback, we'll bring you in so we can do a mock with you as well. So I'll be keeping an eye on that, and I'm sure Sarah will as well. But I'll give some. Okay, so Ophelia, too many. Okay, so yeah, constructive. Now I'm saying as well. Constructive. There was some hesitation in there, and I think possibly that's because you're thinking of the exact words that you want to say, and you want to be as accurate as possible. Yes. And that makes sense. Of course, you want to make as few mistakes as possible. And that was the positive side, is that what you said generally was very accurate. Grammatically, it was very strong. But you have to be careful as well, because if you hesitate too much, then your fluency becomes affected by that as well. So that's a fair point by Ophelia. Maybe there was a little bit too much hesitation sometimes when you were giving responses. The positive side, as I said, was the fact that what you said was very accurate. So grammatically, it was very strong. In terms of questions, didn't ask too many questions. Well, I mean, you did ask questions at the beginning, which is a good way to start, about the situation, the condition of the child, etc. There were times where I wanted to add some extra information, maybe an opportunity where you could say, is there anything else? Maybe at some stage as the conversation is developing, might have been a good way to help build further communication. But at least at the start, you did give an opportunity for me to express the situation, and I did feel involved, and I felt as if you were listening to what I was saying. So I thought generally the communication was pretty strong. Just be careful though a little bit with details, Sarah, because you did mention a lot of the stuff that was on the candidate card, which was good. You obviously talked about chicken pox, and then when you talked about suggested treatment, so you mentioned the cream, but I think it would have been good to mention what some of the other options might have been, because then as a parent I might have felt more involved and thought, well, actually, yeah, I know my child, it's likely he would respond better to maybe one medication than another, just in the sense of what the child might be more comfortable with. So it might have been worth mentioning a little bit more in terms of that detail. But the other parts of the task you dealt with well. You mentioned relevant details, and you did make me feel as if I was informed as to the situation. So Sarah has made the comment in terms of lack of leadership. I think maybe that's just to do with the hesitation again, because again, it does seem if you're hesitating too much, as if you're not certain about what you're saying. So to avoid that hesitation makes you seem more confident. And again, it shows a higher level of fluency. So accuracy, very good. Dealing with the task, you dealt with 90% of it, but just a few more details would have been good. Yeah, the main thing to focus on to make further improvements would be just to try and avoid hesitating too much. Just to speak as much as possible at a natural pace. That would be a way to improve. Okay, so thank you very much. Thank you, Sarah.
You're welcome.
And thank you for the contributions here as well. So I can see, Ophelia, you've made a lot of contributions here. So I'd like to bring you in next as the next person to speak, and I'll do that now. Oh. So.
Hello.
Hi there, Ophelia.
Yes, please.
Hi. Are you ready to contribute to a speaking exam today?
Sure.
Perfect. Okay. So could you just let me know, are you a doctor or a nurse?
I am a nurse.
Hello.
Perfect. Okay. Let me just bring you in then, Ophelia. Okay. So, can you see the candidate card that I've just brought up here?
Hello.
Hi
Yes.
there. Yeah, Ophelia. Yep, you can see it. Okay. So, just as before, then you've got 3 minutes just to have a look at the card, and then we will do the role play. Okay.
Okay.
Okay. Perfect. Okay, Ophelia, are you ready to begin?
Yes, please. I'm ready.
Perfect. Okay, so when you're ready, let's begin.
Okay. Hello. Good morning. My name is Ophelia.
Good meeting.
Hello. Good morning.
Hi there.
My name is Ophelia. I am a nurse in this hospital, and I'll be taking care of you and your son today.
Okay, thank you. Thank you very much.
What's your name and your son's name?
Yes, my son's called Joe, and I'm Alex.
Okay. All right. Alex, I see that your son has developed a complication of mumps.
Yes. Okay. Yeah. I mean that's the thing. I was told that he had a complication following mumps.
Okay. So when was the mum developed?
This happened a few days ago. That my child had to go in. But I just wanted to know, has my child fully recovered? Is he okay now?
Yes, exactly. He has fully recovered from the mumps, but he has developed a complication of the mumps called meningoencephalitis. And it's quite similar to meningitis and then encephalitis, that is inflammation of the meninges in the brain.
Oh, wow. That sounds dangerous.
It's not that much dangerous. Actually, he has recovered from it, and then we are doing everything possible to help him recover fully from it. And also with your 2-year-old son, I know you have a 2-year-old son as well.
Indeed, yes, I do. Yeah.
Okay. Has he also developed any symptoms?
No, he hasn't. Why? is it likely that he will?
Oh, usually mumps is it's infectious, so he can also be infected with it. But there's a good news that there's availability of vaccines that can be used to cure both of them. When they are vaccinated against it, there's no chance they are going to, get that infection again.
Oh, so you're saying that my 2-year-old needs to be vaccinated?
Exactly, both of them need to be vaccinated.
Oh, okay. I wasn't aware that the vaccinations were available, to be honest. But
Yeah, they are.
I'd like to know more about this because I'm a bit worried about the whole vaccination process.
All right. Actually, do you live with both of them in the same house as well as your wife?
That's right. Yes.
Okay. So I'm going to explain to you the risk and then the benefits of these vaccination. Okay. The risk, if both children are not vaccinated, there's a possibility that once your child has recovered from it, it can transfer to your younger child. That is the risk for this. And then with the benefits of this vaccination is going to help both children to stay off this infection, that is mumps. And then mumps has got a little bit of complications in the near future if they get it. Once your child is vaccinated, he will not get any complications from these mumps.
So, but what could be the danger of being vaccinated for my 2-year-old?
Oh, the danger of him being vaccinated, probably it's the pain he will go through following the vaccination. And then what we will do is that we'll give you paracetamol or there are some drugs that the doctor can also prescribe as well. So if the child has any fever or the child's temperature rises, you can give paracetamol to the child and then off you go, the baby will be okay. So I really recommend the vaccines for both of you. I hope you're okay.
So there's a chance, obviously there's the pain of the injection, but I've heard things like sort of a link between like autism, for example. Is that something that could happen?
Not really. Your child cannot get autism from being vaccinated against mumps. No, that is not true. Do you again have any questions about this?
No. Thank you for the information.
Okay, so when your child had the mumps, how many days? When did you realize that your child is having symptoms of mumps?
When did I realize? To be honest, it was like about a week ago when the child came in.
Okay, did you give any first aid in the house?
Did I give first aid? No, I brought my child into the hospital.
Okay. So we are doing everything possible to make sure that your child recovers fully. And I can assure you that your child is fully recovered from this infection. And then with the introduction of these vaccines, your child is going to be cleared of any infection.
Perfect.
I hope you're okay.
Okay, thank you. Thanks a lot for that then, Ophelia. Good. So again, sort of any feedback that you have for Ophelia here, it's all useful. It's useful for you to be able to listen and to reflect, and obviously, Ophelia as well, I'm sure will appreciate it too. So just as usual, in terms of the actual task here, generally I thought it was dealt with well in terms of the content. So I will just mention, there were some points where you perhaps mentioned things that didn't need to be mentioned. So in terms of the technical jargon, talking about the meningoencephalitis, for example, that's probably just going to sort of confuse and maybe worry the parent. Yeah, I think, focusing on the fact that, look, the mumps, because, that's more of a common term, and that the child has fully recovered, I think that's enough really, rather than sort of talking about sort of too many details which might worry the parent unnecessarily. But you certainly dealt with the task. You were very strong in terms of the importance of the vaccination, which was good. You answered my questions. You explained what the benefits would be, and then you did ask me as well at times, if there are any other questions that I have, which is obviously important to do to make sure that in this case, the carer is fully informed. There were some moments maybe where I thought because there were times where I wanted to ask some questions, and maybe sort of moments you could have sort of paused a little bit just to allow me to contribute a little bit more. Like I say, it was good. It was good that you asked me if I had questions at a certain stage, but sometimes you have to be prepared to kind of to pause a little bit if I want to say something at that moment, and then it makes your response as appropriate as possible. Sarah said here that you were very strong with leadership techniques, and I think you guided the conversation very well, and you provided me with lots of relevant information.
Okay, thank you.
Yeah, no, absolutely. And I think anything else I'll say? Yeah, generally speaking, the language was good, the grammar was good. You were using some good linking phrases, things like following the vaccination, and when they are vaccinated. So some good use of sort of passive forms. So that was good. Just a few little mistakes on grammar. At one point you said it's not that much dangerous. So that much again. You'd want to say it's not particularly dangerous, or something of that nature. Would be correct. And then you also said a little bit of complications. So a little bit of so something like some complications.
Some complications.
Would be grammatically correct. But yeah, again, overall strong, well guided, good focus on the actual task. And I felt fully informed throughout the interaction.
Okay, thank you so much.
No, thank you. Okay, so we've got time to do one more role play. Just having a look here at some of the contributions. So I can see Sarim. We've got quite a few contributions from Sarim. So I'll just bring Sarim into the conversation. Oh no, doesn't look like I'm able to. Okay, is there anyone who would like to?
Hello.
Hi there. Hi Sarim, how are you? You okay?
Hello, hi Alexander. Yeah, I'm good. How are you?
Good. Yes, I'm okay. Thank you. Thank you very much. Okay, Sarim. So we've got time to do a final mock exam with yourself. Could you just let me know? Are you a nurse or a doctor?
I'm a doctor. Yeah.
Okay, perfect. So I'll just bring up another role play scenario for a doctor. Should be this one here. Okay, great. Can you see the role cards that I've just brought up?
Yes, I can see this.
Brilliant. Okay, then, Sarim. So we've got 3 minutes then. So you have a look and you can prepare your response, and then we will do the role play. Okay.
Okay.
Okay, Sarim, are you ready?
Yes, I'm ready.
Okay, perfect. So let's begin.
Hello there. I'm Dr. Sarim, one of the doctors in the medicine department today. How am I supposed to help you?
Hi there, Dr. Sarim. I'm just here really because I'm just having a few issues just with balancing things. I mean, just to give you a little bit of context, I'm working full time. You know, I'm married, I've got kids, but a few months ago, my mum was diagnosed with Alzheimer's disease. And she's been living with us. And to be honest, I'm just finding it a little bit difficult at the moment, just with family and work commitments. So I'm struggling to sleep, and I think I basically need something that's going to help me sleep. So I can feel better and deal with things in my life.
Okay, Alex. I'm sorry to hear about your mother's condition, and from what you have told me, she's having Alzheimer's, and you're finding it difficult to. I mean, you're not getting enough sleep, and you're stressed out after work, and you have to take care of her, and you have to take care of your kids, and
there's a lot to balance.
Yeah, I can totally understand. I can realize how difficult it must be for you. And I really appreciate that you're taking care of your mom very well, but that is stressing you. And I would just say that I'm a bit hesitant I'm sorry, but I'm hesitant to prescribe you any sleeping pills because you can easily get dependent on it. Do you know what I'm saying?
Well, I've never been dependent on anything in my life, to be honest. I don't think that would be an issue. It's just, I just need something to help me get to sleep because I'm feeling anxious all the time and it's not helping that I'm not sleeping. So I need to get some sleep.
I can totally understand. Everyone needs sleep after work. I'm sure you must be working hard daily and you really need sleep. But I would recommend you. Can I recommend you with some other alternatives? I would really appreciate if you can just follow what I say. Is that okay for you?
What sort of alternatives?
See, Alex, I assure you that you're in the best care. I mean, you're in the best pair of hands, and I would recommend you for your benefit. I would recommend you with some herbal teas and regular exercises, and I would recommend you to go for meditation. Is that okay for you?
Well, I mean, is that going to help me sleep? I mean, I need something that's going to do that.
Yeah, it will really relax your mind after work, and you will get a good sleep at night, and you can have peace at night. And I would really tell you and advise you a few other things. You can have more comfortable sleeping pattern if you really follow this.
Well,
sleep hygiene. If you really follow the sleep hygiene, you can have.
It's just difficult. It's difficult to do because obviously I've got so many commitments, so it's difficult to have a strict routine, really.
No, it's not about the strict routine. How about doing it for 2 or 3 days in a week, and I mean, just having a few cups of herbal teas and meditating for 2 or 3 times. That would really encourage you at work, and that will peace out your mind, and you can have a good sleep at night.
Right.
And I would really advise you. How about if I advise you to transfer your mother under a home care nurse at the old age house? That would be really helpful. How about it?
I don't really want to do that. I mean, to be honest, put my mum in a home, I'd feel bad about that.
No, it's not like that. I'll give you a leaflet. I mean, there are many other patients which I am dealing with, and they have really given me good outcomes, and they have really they are really satisfied by the care, and they take really good care of the old people. And you can regularly go and meet her. It's not that you have to leave her and she'll be neglected over there. She'll be there in the best care of hands.
Mm. No,
And I would also like you. Are you following me? Is it
Sure.
okay if I ask you a few more questions and I advise you on something?
Yeah, I'll tell you what I'm going to do though, Sarim, just because we've actually reached the 5 minutes. Yeah, I'm just going to have to pause it there. But yeah, obviously, the stuff that you talked about was all relevant. If in the actual exam you don't actually get through all of the elements of the task, as long as you're focusing on relevant elements during the conversation, you're not necessarily going to be penalized for that. We can have a look at some feedback. I'll just have a look. Sarah's put some feedback here about intonation. Okay, and maybe a little bit more variety. I thought, yeah, I mean, there was some good vocabulary that we were using there. I thought, I'm hesitant to prescribe. It's not such a common vocabulary item, so you're showing that you've got a wide knowledge of vocabulary, and you're also using it grammatically correctly as well. To plus infinitive. So there was some good stuff there. And it's hard into home comes to it. Yeah, I think it was a good performance overall. So obviously you can see some positive comments here. Ophelia really impressed. There was definitely some good stuff. It was a difficult role play situation because obviously you were telling the patient something that he didn't want to hear, and so you used a lot of good language in order to try and reassure the patient. I assure you are the best pair of hands, and you were disagreeing with the patient, but not in a way that was confrontational. You're doing it in a way which was trying to negotiate a way forward. So it was a really good manner. You stayed very calm, and you were also very sympathetic to what I was expressing. So I thought that was good. We did run out of time, and again, you're not necessarily going to be penalized for that, but one thing that could have helped to focus more on the final step would have been, you mentioned the herbal teas and the exercise, and you did mention some of those details. That was good. Maybe we stayed on that for a little bit too long. And what we could have done, you could have made some of those suggestions. And then when I said, but to be honest, it's difficult to have a routine because I've got so many commitments, that might have been a good moment to then move on to the advice in terms of seeking more information about social care services. And then we would have had more time to say, but to be honest, I think to really manage your stress symptoms, counseling is something I would recommend. So I think, yeah, it's just a question of how much time do we spend on each of the tasks. I think probably the stress management was more important maybe than, I'm sure regular exercise, herbal tea, ideally in an ideal world, it's something that the patient would be able to do. But sometimes you do need something a little bit more solid, I guess, that you need to communicate to the patient. So I might have spent a little bit less time on that so that I had more time to focus on that final task. But overall, really good manner. You dealt with the task really well. You showed a lot of empathy and a lot of understanding. Your use of English was very accurate. Very, very few errors there. And yeah, you did use some repetition, but I thought it was used in a way actually that was very helpful because it can provide some structure in order to sort of have those kind of markers to keep repeating, look, you're in a really good pair of hands here, and even asking me, is this okay? Is it okay if I continue to provide you with advice? Because you could see that obviously it was a difficult situation. So a really good manner shown throughout, which you're going to get a lot of credit for in the actual exam. So thank you for that, Sarim. Okay.
Thanks,
No problem at all. Okay, so thank you to all of you for your contributions today. All of you who've contributed in the chat, all of you that contributed in terms of the mock exams. I hope that you've got something useful out of it, and I'll hopefully see you again in the not too distant future to do some more practice and to keep moving forward towards those OET goals. So take care and speak soon.